Hey, this is Doug Field along with my co-host Brent Macy and our guest host Liz Freyer with Intrepid Consulting. Welcome back to this segment, Healthcare Consumerism Radio, where we're going to continue a discussion about a very disruptive part of this marketplace, the emerging defined contribution private exchange solution and marketplace. And leading this discussion with us today is Gene Moore, the lead with Towers Watson OneExchange. Gene, good morning.
Good morning. Thank you for having me.
Nice to have you on the program. Give our audience a little background on Towers Watson OneExchange.
Towers Watson OneExchange is a private exchange for all different sorts of employees and retirees. We have segments for Medicare retirees. We have segments for pre-65 retirees. We have segments for active employees, COBRA part-timers. But the whole goal is to provide access to different segments of the population to private exchanges or to public exchanges through one facilitated technology tool.
Yeah, there's certainly a lot of questions out there from employers and those working with employers. What are some of the most commonly posed questions that you and the team faces out in the marketplace?
Yeah, I think that probably the most important question that employers are asking themselves right now is whether their healthcare program is structured in a way to be sustainable in the long term. Mm-hmm. And when I talk about sustainability, I really, peg towards the healthcare reform excise tax that goes into play in 2018. And there's really two components to that. So the first part of the excise tax is that employers have to get their costs for their healthcare programs below that threshold in 2018 so they don't have to pay a tax. But probably the more difficult part of the excise tax threshold is that while the threshold is indexed to increase over time with inflation, it's actually indexed to increase with CPI, not healthcare inflation. And so the impact of that is healthcare plans, employer healthcare plans, are going to have to trend at more like 1 or 1.5% instead of the 5 or 6% that we're seeing today. And so that's actually one of the real big reasons that employers have shown so much interest in private exchanges is the promise that those exchanges can actually deliver meaningful cost savings in the long run.
Do you think that's because employees are choosing lower cost plans and that's affecting their utilization?
I think in some instances it's due to that. I think there's also the impact of mass purchasing power for the exchanges. Mm-hmm. So, for example, for our exchange, we've put in a lot of really high-performance plan features so that it can mitigate costs in the long run, and that includes things like dedicated nurses and dedicated physicians to make sure that the care is appropriate and right. And what the exchange brings to the table is the ability for employers to access that kind of purchasing clout when they didn't have the ability to do that on their own before. So while I think there's some additional consumerism from the exchanges by employees buying down, I think that at the end of the day, the exchange isn't going to be successful unless there's some, really high-performance features that help keep medical costs down just through the program itself.
Now, Gene, you guys actually have some results from the enrollment in your exchange. What have you seen as far as results up to this point?
We do, and when we think about success, at least for Towers Watson OneExchange, we aren't viewing success as beating the market because, as we know, the market is 5 or 6% increases. We actually view success as beating or meeting CPI, and so for our first-year clients, we actually are happy to report that their trends are running at 1.8%. Mm-hmm. Which is significantly lower than market and right about at CPI. And one of the interesting things about that 1.8% is that actually doesn't include the impact of employees or consumers buying down to lower levels of coverage. That's the gross trend number. And if we incorporate some of that buy down that we see on the exchanges, that 1.8% would be significantly lower. So we're really pleased about those results, but I think that drives back to the point of it's not just the buy down that's going to create the savings, but it's the underlying high-performance components of the programs that will make them sustainable.
Now, with the employers right now, is cost the number one driver that they're looking at around their benefit structures, their healthcare benefit structures specifically?
Well, so So it's interesting. We just did our Healthcare Changes Ahead survey a few months ago, and so 87% of employers have said that healthcare is going to be a really key part of their employee value proposition going forward. But they also said that healthcare costs can't continue at the level that they're continuing for them to be able to keep their plans in place.
Mm-hmm.
So 81% of those employers are actually planning moderate or significant changes to their healthcare plans to manage costs before 2017. So I think those two data points would say, cost is really important in terms of, providing healthcare benefits on a long-run basis.
Jean, I remember when the law passed, 2014 seemed so far away, and 2018 seemed light years away. What do you think employers need to be thinking about as it relates to the Cadillac Tax and ACA?
Yeah, it's really interesting. It did seem like 2018 was forever away, and we had all sorts of time to, not worry about it. Mm-hmm. But the reality is, it's here before we know it, and so, like I said earlier, there's sort of two components to the excise tax. So the first component is getting below that initial threshold in 2018. That's not hard to do because employers can accomplish that by just reducing plan design significantly to get there. So I think one of the things we've seen is employers are saying, well, I don't need to worry about that until 2017, and I'll just change my plan design. And that is true if that's the way you want to go about it. But the bigger challenge is trying to manage to that 1.5% trend rate on a going forward basis. Mm-hmm. And you can't wait until 2017 or 2018 to start bending the trend line, because bending the trend line is actually predicated on employee behavior changing and getting different kinds of protocols into the programs. And so our message to employers is you can't wait till 2018 if you're going to try to stay below that trend of 1.5% or so.
Don't you think, Jean, that's also the driver to defined contribution married with a private exchange model? I mean, it is a very real solution that provides the employer with some flexibility around healthcare costs, but also improving the benefit experience for their employees.
Well, absolutely. So the defined contribution approach has been very, very good at, engaging employees and giving them the choices that they want and desire actually on their plans. One of the things we've seen is, while initially the interest in the private exchanges was all about managing costs, and a lot of the early movers were really focused on cost reduction, but we've seen a number of employers in the last, 8 to 10 months who are looking for a 2016 adoption, that the reason they want to put in an exchange isn't necessarily because of the cost, but because of the improved employee experience. Mm-hmm. Our surveys have shown that employees really like a shopping experience, and that applies to healthcare as well. And so the exchange provides them with a defined contribution amount, and they can go out to this technology and see all of their choices and all the carriers and a whole array of things to choose from, and it feels very much like an Amazon experience, and it has been really well received by employees. And as a matter of fact, our survey of our first-year clients showed that 80% of the employees on our exchange understand their health care benefits better today on the exchange than they did prior to the exchange.
Yeah,
so there's a lot of benefit from a consumer perspective of these exchanges, and the employers are starting to see that now.
Jean, don't you, employees across the country, they're real adults, and if employers treat them as real adults, and they understand there's going to be some costs involved, that they need to have some skin in the game. But to your point, they will embrace this shopping experience, this opportunity to develop plans of choice that fit their family style, fit their family unit, whatever that unit looks like.
That's exactly right. And it's interesting. Employees tend to over-insure when they're choosing coverage from their employer for a couple of reasons. One, employer plans tend to be more generous than they necessarily need to be for a lot of different reasons, not excluding things like union pressures and other things. But what we found is that this opportunity to choose plans that meet your own specific family's needs has been a really big benefit for them, and we've seen people choose less generous levels of health care coverage because they don't really need it, and then they actually use that money to purchase other kinds of coverage that they really do need or want, like homeowners insurance or pet insurance or things of that nature. So it's been a really interesting thing to watch how consumers are buying down on health care and buying up in other areas.
Jean, in the last couple minutes that we have on this segment, what are, the private exchange market is exploding right now. Employers are looking at it. There's studies out there that, I've seen all the way up to 90 million people flowing through private exchanges across the country. In the final couple minutes here, do you see that uptick in adoption taking place, and where do you see this market moving in the years ahead?
Yeah, so I think, yes, we do believe that those numbers, I hadn't seen 90 million, but we've been seeing like 40 million by 2018, I think was an Accenture number. And we absolutely believe those numbers feel right based on the volume of interest and activity that we've had within our own exchange. I think that what we'll see for 2015, we kind of know already what that's going to look like. Most of the early 2015 adopters were smaller to mid-size employers because they really couldn't get the bang for their buck in terms of negotiating leverage and clout with the carriers, and so they weren't maximizing their cost efficiency. But starting in 2016, I think we're going to start seeing some really big-name employers moving to the exchanges. And what we've heard, industry by industry, that everyone's waiting for the first mover to fall, and then everybody else will be a quick second follower. I think I'm sorry.
And Doug and I, and we echo that. And Doug and I actually had a meeting with a large employer that's here in the Atlanta market, and he said to us specifically, I'm looking right at the private exchange market because I think it could be right for the employee population that I have. And I think, to your point, a lot of that discussion and look and see approach is taking place right now with these people looking to make the jump too.
Yep. Absolutely.
Well, Jean, let our audience know how they can contact you regarding your private exchange platform.
Well, they can find out more information on our website, towerswatson.com, or they could contact me directly at jean.moore@towerswatson.com.
Hey, Jean, we really appreciate you joining us on the program today. Have a great weekend out there, and if you can make it to IHC Forum West in Las Vegas, November 10th through 12th, we'd love to have you. We're going to have a lot of discussions about private exchanges, so if you could make it, we'd love to have you out there. And Liz, thanks so much for joining us in the studio as our special guest.
Yeah, absolutely. It's been a pleasure. Thanks, guys.
All right, everybody. Stay tuned.
Everyone.
All right, have a great weekend, Jean. And everybody out there, we'll talk to you next Friday on Healthcare Consumerism Radio.